Great. Today is Tuesday, January 12th, approximately 4 o'clock in the afternoon. I'd like to call this Board of Commissioners School Board meeting to order. Madam Clerk, if you would take roll, please.
Commissioner Fox?
Here, Commissioner Chambers at the Bay County Building.
Thank you. Commissioner Begic?
Here,
At where?
Bay City, Monitor Township.
Thank you. Coonan? Mr. Coonan?
Here, 706 Sydney Street.
Thank you. Commissioner Herrick?
Here, Bay City.
Thank you. Commissioner Radke?
Here in the commission chambers.
Thank you. Commissioner Johnson?
Here, Commission Chambers.
Thank you. And Chair Krieger?
Here, Bay County Commissioner Chambers. Thank you.
All members present, Mr. Chairman.
Very good. We'll stand for the invocation and the pledge, and I'd like to have a moment of silence, if we could, for Bill Karbowski. He was past supervisor of Garfield Township. Thank you. Stand.
Almighty God, our Heavenly Father, your generous goodness comes to us anew every day by the work of your Holy Spirit. Lord, lead us to acknowledge your goodness and give thanks for your benefits, Lord. We ask that you give this board guidance today as they begin a new year. Give to them the courage of their own convictions so that they can work for the common good of all. And may your divine providence guide our county and bring dignity, prosperity, and respect to every citizen in the community. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Try reading with little kids on it.
All right, next we have the minutes from December 8th. Motion to approve would be in order.
I'll move the minutes. Vaughn, Begic.
I need a second. Support from Commissioner Johnson. Any discussion on the minutes? If none, all those in favor signal by saying aye.
Aye.
Opposed, same sign. We're good. Next, we have citizens input. If there's anybody.
Mr. Chair, excuse me, need a roll call on the minute approval?
Oh, I'm sorry. Roll call, please.
We start our roll call today with Commissioner Johnson.
Yes.
Thank you. Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
Herrick?
Yes.
Radke?
Yes.
And Krieger?
Yes.
7 yeas, 0 nays, motion to approve the minutes carries.
Thank you, Madam Clerk. We'll move into citizens input. If there's anyone from the public that's on the line that wish to speak. No one there. Let's move into petitions and communications. Under A, we have a letter of resignation from Mike Rivard. A motion to receive would be in order.
So moved.
Coonan.
Seconded by
I'll second it.
Commissioner Fox. Any discussion? With none, roll call, please.
Commissioner Fox?
Yes.
Begic?
Yes.
Coonan?
Yes.
Herrick?
Yes.
Radke? Radke?
Yes.
Johnson?
Yes.
And Krieger?
Yes.
7 yeas, 0 nays, motion carries.
Thank you, Madam Clerk. Next, we have from the Bay County Executive, the listing of authorized department heads. A motion to receive would be in order.
So moved. Herrick.
Support, Begic.
They're fast.
Very good. Any discussion? No discussions. All those in favor, we'll have a roll call vote.
One moment. Starting with Commissioner Begic, please.
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, motion carries.
Thank you very much. Next, we have a request for appointment to the Bay County Building Authority by James Badour. First, a motion to receive would be in order.
So moved. Coonan.
He beat me.
We have a motion to accept by Mr. Johnson and supported by Commissioner Coonan. Any discussion on the appointment?
Motion to receive.
I'm sorry, motion to receive. Roll call, please.
Commissioner Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, motion to receive the letters of appointment carried.
Thank you, Madam Clerk. Now, a motion to appoint would be in order.
So moved.
Moved by Commissioner Fox,
Johnson.
supported by Commissioner Johnson. Discussion. Any questions on the appointment?
I do have one question.
Yes, Commissioner Fox.
How long is this appointment for?
It'd be a 4-year term.
4-year term. Okay.
Yep.
Thank you.
Okay. Any other discussion? If not, roll call, please. Whoop, I'm sorry.
Hey, we have to,
I'm
yeah,
just going to clarify, it's a 6-year term.
Oh, 6-year. I'm sorry, I thought it was 4. Okay,
Excellent.
very good. All right, Madam Clerk, if you would take a roll call, please.
starting with Commissioner Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, appointment of James Badour.
Jamie. Jamie Badour.
I'm sorry.
Okay,
James Badour, okay. Yeah, I'm gonna switch that on. This was,
Let's move
we did talk about that.
Appointment to the County Veterans Affairs Committee. We have 3 candidates that have submitted their names. I guess what we should do first is move to receive the 3 names.
I'll move to receive those 3 names. Begic?
Or Coonan.
Okay. Any discussion? I think Commissioner Fox had a question, maybe, Ann?
I do have a question. 2 out of the 3 candidates went through the formal application process. There's 1 candidate that there's a letter of recommendation, but no application for the position. So my question is that one application valid?
Yeah, file an application.
Okay.
Deanne?
Yes,
That's, I believe that's a valid, it's a recommendation from the American Legion. According to our bylaws, there can be a service organization that can recommend an appointee. And I don't think they have to fill out the formal application form. Deanne might know more.
no, I don't.
It's the first time we've done this, so, but I was just reading the bylaws and it says a service organization can nominate a person and submit them, and I don't think he has to fill out the formal application form, the way I read it.
Maybe Amber could chime in?
I agree with Commissioner Begic.
Okay.
Okay. So we do have the 3 candidates.
Correct.
Any other discussion on it then? With that being said, if we could do a roll call to receive these 3 applicants, Madam Clerk?
sure. Starting with Commissioner Radke, the motion to receive.
Yes.
Commissioner Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Krieger.
Yes.
7 yeas, 0 nays, Motion to receive carried.
Very good. So at this point, if you would take roll with the commissioners on who they would want to select, that would be in order. Thank you.
Okay, we're starting with Commissioner Johnson, please. Name one candidate.
It's a tough one, talk to both. Tim Eckstein.
Commissioner Fox,
Fred Zipper,
Commissioner Begic,
Tim Eckstein,
Commissioner Coonan,
Dave Sloger.
Commissioner Herrick,
Eckstein.
Radke,
Mr. Tim Eckstein,
and Chair Krieger.
Dave Sloger.
Vote total: Sloger 2, Eckstein 4, Zippler 1.
Thank you. So,
Get that for the record?
you're all set, Madam? So a motion then to appoint Tim Eckstein to the Bay County Veterans Affairs Committee would be in order.
So moved. Herrick.
Port Begic,
Any other discussion? That being said, roll call, please.
Commissioner Fox,
yes.
Begic,
yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
yes.
Johnson,
Yes.
and Krieger.
Yes.
Mr. Eckstein appointed by unanimous vote, 7 yeas and 0 nays.
Thank you, Madam Clerk. That'll do it for petitions and communications. Let's move into resolutions of the committee. We'll go to Ways and Means, and that would be the chairman, Chairman Ms. Fox.
Okay. I move to support item number 1, 2021 Child Parent Legal Representative Grant, Probate Court.
Support Begic,
Discussion? No discussion?
Yes, no, I do have a question.
Very good.
I move to support it, but I have a question relative to the resolution and the letter. So the resolution reads like this grant has already been awarded. And the letter reads to me like the grant has not been awarded. We are approving to pay these monies and they're hoping to seek reimbursement. So it's not clear to me
Sure.
how this is supposed to work.
So, is it, Britt?
Yep, I'm here, Ernie, if that's okay if I speak.
Please.
Okay. Yes, so we had to reapply for the grant quite a bit earlier this year, just to meet some state deadlines, as that also kind of lined up with our budgeting with the state. And so what the state is allowing us to do now is amend that. Part of the grant requirements is that we find a way to increase the compensation that our dependent neglect attorneys are receiving. So what we're asking for, although the grant has already been approved, both at the county, state, and federal level, is an increase in the amount that we are going to provide our attorneys hourly. The state has already started to make those amendments in preparation for today's commissioners meeting. So they're on the same page with us. In fact, they're supportive of it because that is part of our agreement. It just took us some time to establish amongst the administration and the judges here at the courthouse what we were going to make our ask for that increase.
Okay, thank you.
Very good. All right. Any other discussion, questions? If not, roll call, please.
Commissioner Fox, please.
Yes.
Begic,
yes.
Coonan,
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution approved.
Thank you.
I move to support item number 2021-2, agreement with Brown and Brown, the workman's comp personnel.
So moved.
No support.
Yes, Commissioner Coonan.
Thank you, Mr. Chairman. And, we've got some 3 new commissioners, and this is regarding the workers' comp and the excess liability insurance, correct?
Yes.
All right. We all know what workers' comp is. Can somebody give us a definition of what the excess liability insurance is?
I can do that. Is that okay?
Thank
So the excess liability insurance, we are self-insured for workers' compensation, but the excess liability covers amounts over a certain dollar value. So it's anything over $450,000. If we had a claim of that amount, they would cover anything over that.
All right. Thank you, Tiffany.
Very good. Any other discussion?
Yeah,
Commissioner.
yes, Commissioner Begic. So this is the 4th year. I can't remember, what is our policy about rebidding these? So this would be the 4th year of this policy. Do we rebid after 3 or 4 or 5? Can't remember what we do before. Well, when we go for new bids, after how many years?
Sure, maybe Amber, can you address that?
I can try. It depends because it's a bit of a round robin. It depends on the length of the initial contract that we are entered into, and it depends on the amount of the contract that we have entered into with the entity. Usually, we will go out for bid at the end or expiration of a contract. So if it's a 5-year contract, we'll go out for bid at the end of that contract.
Thank you.
Okay. Any other discussion? None? Madam Clerk, roll call, please.
Commissioner Begic,
Yes.
Coonan,
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Krieger.
Yes.
Resolution 21-02 passed by 7 yeas, 0 nays.
Thank you, Madam Clerk.
I move to support item 2021-3, agreement with Midwest Employers Casualty Company.
So moved. Coonan.
Discussion. With none, roll call, please.
Commissioner Coonan,
Yes.
Eric,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution carries.
I move to support item number 2021-4, contract with Delta Dental.
So moved. Coonan.
Discussion. With none, roll call, please.
Commissioner Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
Resolution 21-04 approved by 7 yeas, 0 nays.
Thank you, Madam Clerk.
I move to support item 2021-5, amendment to the 2021 CPBC agreement.
Support. Coonan.
Discussion.
I just had a question about what the changes were from the previous provider. Was it a cost thing or a co-pays, or what made you switch to Delta Dental versus the previous provider?
I'm not sure if I have someone that can address that.
Tiffany, probably?
Yes, I can address it.
Yeah.
So we made the change. The co-pays and everything are staying the same, but Primarily the changes due to network changes in the Blue Cross Blue Shield program, and dentists in our area not accepting that coverage anymore. So in looking through it, this seemed to be the best option for our employees to go ahead and retain all of the dental services and benefits that they had previously. So there is actually no change to the copay structure or coverages or anything like that.
You got to be able to see a dentist, so you need a provider. Thank you.
All right. Any other discussion? If not, roll call, please.
Commissioner Radke,
Yes.
Johnson,
Yes.
Cox,
Yes.
Dick,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Krieger.
Yes.
7 yeas, 0 nays, resolution passed.
Thank you.
I move to support item number 2021-6, body transport agreements.
Need a support?
Coonan.
Any discussion on the resolution? That being said, roll call, please.
Johnson,
Yes.
Cox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays, resolution approved.
Thank you.
Okay, I move to support item 2021-7, the payables for the general fund.
Coonan.
Thank you, Kim. Any discussion on the payables? Roll call, please.
Cox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
and Krieger.
Yes.
Krieger, yes?
Yes.
Thank you. 7 yeas, 0 nays. Resolution carried.
Okay, I move to receive the analysis of the general fund equity 2020.
Need a support?
Support?
I'm sorry, who supported that?
Johnson, sorry.
Thank you.
Very good.
Appreciate it.
It's hard with these masks.
I'll learn to get louder.
All right, so we have a motion and support. Any other discussion? If none, all those in favor, signal by saying aye.
Aye.
No,
We're still. Go ahead.
Commissioner Begic,
Yes.
Commissioner Coonan,
Yes.
Commissioner Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Krieger.
Yes.
7 yeas, 0 nays. Motion carries.
Okay, and
I have a question. Did we
Yes.
miss 2021-05? I don't remember us voting on that one. And that would be Beth. Does anybody remember us voting on 2021-05? It's the agreement,
Delta Dental during 2021-05.
or is it 06? There was one in,
Delta Dental's 04.
Mm-hmm.
Ron talked about Delta after we did 05.
We did vote on it.
Yeah, you came back, Vaughn, after we voted to talk about Delta Dental.
down to, okay, all right, thank you.
Yeah.
We're good.
I remember. I think it has to do with age, Vaughn. You might be just a little bit older than me.
Yeah, well, I'm here at home, I'm distracted watching Fox News and stuff, so.
It had to be a major distraction. All right.
That explains a lot.
I ask for a motion to receive the Executive Director 2007-11.
Support.
Very good. Any discussion on the executive directive? With none, roll call, please.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
and Krieger.
Yes.
Received by 7 yeas, 0 nays.
Very good. Commissioner Fox.
My work is done.
Very good. And you did a very nice job for the first time. So we're done with Ways and Means. We'll move into Personnel and Human Services, and that would be Commissioner Johnson.
Good afternoon. Let's see, from Personnel and Human Services, we have resolution number 2021-08. That involves a vacancy that exists in the Bay County Prosecutor's Office created by an upcoming retirement of an assistant prosecutor. They'd like to hire someone in at level 4 starting salary.
You move that, Jamie, and I'll support it.
I'd like to move this resolution.
Very good. And Kim,
Support.
any discussion on the resolution? With none, roll call, please.
Commissioner Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
and Krieger.
Yes.
Resolution passed, 7 yeas, 0 nays.
Thank you, Madam Clerk.
And resolution 2021-09. And this is given to post or advertise or fill the following full-time or part-time temporary positions. 911 Central Dispatch, Department and Aging Typist Clerk and Accountant Clerk, Sheriff or Correctional Facility Officer. And Environmental Affairs is looking to fill for retirement the Gypsy Moth Suppression Program and a potential Health Department WIC outreach person. Well, we also have an administrative services for a kennel attendant. I move this resolution.
Support. Begic.
Support by Commissioner Fox. Any discussions? Madam Clerk, roll call, please.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays. Carried.
All right. Let's see, we've got the monthly report from the assigned council. I move to receive this report.
So moved.
Supported by Commissioner Fox. Any discussion? It's good to see these reports coming through. I appreciate the assigned council for doing that. So that being said, roll call, please.
Johnson,
Yes.
Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
and Krieger.
Yes.
Motion to receive the report carried by 7 yeas, 0 nays.
I believe that brings my portion to conclusion, sir.
Thank you, Commissioner Johnson. Again, nice job for a newbie, huh?
Thanks.
You're very welcome. So let's move to the Board of Commissioners. Commissioner Coonan.
Yes, Mr. Chairman, I don't believe we have anything today from the county executive.
Well, we have Resolution 2021-10. Reports from county exec.
Guess I don't see that on my agenda, but I'll move that.
Okay.
Support. Begic.
Any discussion on the county exec report? If none, roll call, please.
Commissioner Fox,
Yes.
Begic,
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Krieger.
Yes.
7 yeas, 0 nays. Resolution carried.
Thank you. Moving on, we do have reports from the county officials and departments. Jim is not here at the moment, and I don't believe, Amber, you have nothing to share, correct?
We have no reports for this meeting.
And Tiffany, anything? Very good. So let's move on to unfinished business. I don't think we've had anything left from last year. New business. Anyone have anything to bring up under new business?
Just like to hear from our health department director.
Yep.
About the vaccination program.
Yep. Joel, if you would like to address, that would be great. Maybe you can give us an update.
Sure, absolutely. First, I'll give an update on the number of confirmed cases and the status of COVID-19 here in Bay County, and then I'll talk about the vaccination efforts. We've seen a pretty significant cut in the number of cases since the beginning of December. If you recall, we were about 19-20% test positivity rate. We are down to about 10% test positivity rate. We still need to cut that in more than half. But it's a good thing that we've cut the number of cases, and the hospital is not as filled as it was back in December. We have seen a number of fatalities in the last few weeks, and that is part and parcel with the significant upswing in the number of cases that we have had. And we are anticipating that while we'll see a slight uptick over from the numbers from Christmas and New Year's, we are hoping that those numbers stay down and continue to go down. There is a new strain you're probably aware of. This was first identified in England in the last few weeks, but it's actually been in existence since September. They believe it may have some implications with some wider spread activity that's taking place in the West Coast, California, and Arizona. And that doesn't seem to be the case here yet. And we hope that that will remain at bay while we begin our vaccination efforts. As of today, we have had about 4 or 5 different individual vaccination clinics that have been sponsored by the Bay County Health Department. There is one taking place currently at the Bay County Community Center. In all, we've distributed pretty close to about 2,000 vaccines so far just by the Bay County Health Department. I know that McLaren Bay region has distributed about another 1,000 doses on their behalf to their employees. And I believe that CVS and Walgreens are in the second week of a widespread distribution of vaccine to nursing homes and long-term care facilities and congregate care facilities. We will be expanding our vaccination efforts through the coming days and the coming weeks. One of the problems that is hindering us so far is the supply of vaccine. For the 5 orders that we've put in so far, we've been only able to receive 3 orders from the state of Michigan. It is my knowledge that as of this afternoon, the CDC has begun to open up those supplies and distribute them down to the state level again. And that's going to mean a more wider stream of vaccine in the coming weeks. And we will see that matriculate fairly soon. We have an overwhelming demand of people that have registered for the vaccine and an overwhelming demand for the people that have indicated that they would like to register but do not have access to the internet. And we are working with the Bay County Department on Aging beginning this week to start to make those calls to those people that they have had contact with and have collected contact information. We will also be rolling out a call center number that Bay County residents can call to register for the vaccine. But I do want to mention this: if you've already registered on our internet survey, you do not have to call and register again. or you do not have to make several registrations on the internet survey. That's not going to do any good. It's not going to get you into line any faster. We are also trying to expand our efforts to begin specialized clinics, especially for populations over the age of 65. We've been in consultation with a number of different providers throughout the community to do this. In addition to that, we are also planning on expanding distribution of vaccine to the rest of the 1B tier, which also includes the remainder of the law enforcement and first responder community that we did not touch, or that we did not reach in our tier 1A category efforts. And in addition to that, that also includes frontline school personnel, including teachers and daycare workers as well. So there's going to be a lot of activity in the coming weeks and months. And, you know, it's kind of a disorganized effort so far at between the federal, state, and the local level. The vaccine comes down, and we're trying our best with the different providers to distribute that as soon as we can. However, as I mentioned before, we are crippled with a lack of supply as of today. We hope to see that change fairly soon. And we hope to get more providers on and coordinate with those providers to get the vaccine to the right people at the right time, at the right dose.
I have a question. Joel, this is Tom Herrick. So obviously I'm of that age where I filled out this survey. How do I know that if, you know, and I see people online saying this too, how did I know that if I filled it out that it was received? There's no confirmation.
Sure.
It's kind of a problem, you know, not only for me, but for a lot of people. I mean, because they're wondering. And just to piggyback on like the teachers, you know, there's a lot of schools that want to go back, but you know, the teachers want to get their vaccinations, of course, and they haven't heard anything from anybody about, you know, well, it's kind of it's kind of a hodgepodge right now. I'm just saying in general across the United States. I see a guy on Facebook that works at the casino that got his vaccination because he works at the casino, and you know, he's like 50 years old, and I go, holy cow. You know, and I'm not the only person seeing this stuff. There's a lot of people, and they're wondering, you know, people on the board of directors at the hospital saying, wow, we got our vaccination because we're on the board of directors, you know, and there's a lot of people that would like to get these things that aren't getting it. And I'm just going to throw a little bit out, another one at you. The guy went to Walgreens, a buddy of mine went to Walgreens saying, and they said, well, you can get on the list, but we're not going to get anything until April, you know, so that's going to, you know, so there's a lot of misinformation out there, but you know, it helped if we had a little more clarity, maybe, you know, even through, you know, if there was something on through the county website that said, this is what will happen this week, these are the types of people we're going to be contacting. But you know, I don't know how to do it, you know, and I know we're learning a lot of this as we're going along, but can you give me, especially if we registered already, you know, how do we know that information was received? That's my question.
Sure. So, Commissioner, you've identified about 5 challenges that we've had to deal with on a daily basis since last Monday. And one of them is that even with our best efforts to try to coordinate an online registration system, the response is overwhelming. We have had 12,000 people register so far. And half of those have come in the last 5 days. And we're doing our best to get in touch with people. All I can say is if you made it through the registration system and you didn't get kicked out or anything like that, then you're registered. You should be okay. We are, like I said before, we are in the process right now. We're going to be vaccinating well over 12, maybe 1,300 people over the next 3-4 days. And, you know, we will continue to ramp up our efforts and get as many people vaccinated as soon as we possibly can. The other challenge that we have is that the rules or the guidelines seem to be changing on a daily basis. Up until last Wednesday, it was the Tier 1B included people over the age of 75. Well, that has been subsequently changed both at the state and the national level to people over the age of 65. Up until about 3 weeks ago, Tier 1B didn't include teachers or frontline school personnel, but now it does. But we do see the necessity of reaching out to these groups and making sure that they're a priority. If we want life to go back to normal as soon as possible, we will do that. But the other problem that we have, as I said before, is that there is a significant challenge right now today with supply. And as I've stated before, we put in a number of different orders. And then the last 2 weeks, they've been more consistent. For the first 3 orders that we put in, we only received 1. And so that's a challenge in and of itself. The other challenge too that we have, and this is one thing I want the average resident to understand, is that vaccines aren't interchangeable. You can't start out with a Pfizer vaccine, which we're almost exclusively Pfizer vaccine here in Bay County because of our deep freeze capacity, and then switch to a Moderna or an AstraZeneca when that comes online. In addition to that, we know that there are a couple of other providers, more prominent, bigger box providers that are going to be coming online fairly soon. And apparently that they've begun a registration system. And we know that people are registering with them as well. So we may have double people in one queue to get a vaccine, and simultaneously in another queue and another with another provider to get the vaccine as well. So we need to do a better job of trying to coordinate. These are significant challenges that we've had to face and put together in the span of about 4 weeks, or try to cope with in the span of about 4 weeks. But significantly, the changes that come on almost a daily basis are pretty substantial. But the good news is that the response amongst the different providers throughout the county, not just the health department, but McLaren Bay Region, Region 7 Agency on Aging, Bay Area Neck Behavioral Health, and a variety of others, has been really, really overwhelmingly good in our response. And there are a number of healthcare personnel that are willing to volunteer their time and help out, because they want to see this effort come to a close, and they want to see the vaccine put to good use as well.
Joel, is there any, since I have multiple people in my family that have to do work in schools, is there a plan, like is it going to go to the school district to let the teachers know, or is there a plan already in place to let for notification on schools?
So I can only speak for Bay County. I know you have family that have worked in school districts in other counties, but in Bay County, what we are planning to do is to meet with all the individual school superintendents and the major providers, as well as the ISD, and hopefully some representatives from the private and parochial schools, to begin a mass vaccination event, hopefully on a specific day, where we can start the vaccines. Our goal specifically is to meet the governor's goal, which is to have every school in session in person by March 1st. And we are pretty confident that we can actually begin some of the vaccines within the next 2 to 3 weeks.
Thank you.
Yeah, Joel, just wanted to thank you for your help. We're trying to get the van drivers, the drive the veterans up to Saginaw, get them somewhere in the queue so they can get vaccinated, so they can transport the veterans up there. I know the VA is starting to give the vaccinations. I talked to a veteran yesterday who's going for his vaccination up there too. So thanks for your help with that. By the way, my mom's at Bay Shores. They started giving I think it's Walgreens or CVS, one of the two started giving them last week. Unfortunately, my mom tested positive the day before she was supposed to get her vaccine. But luckily, so far, she's doing good.
Oh, that's good.
Yes, she looks good.
Okay, that's good to know.
She's tough for 97 years old. Yeah. Thank you.
You're welcome.
Anyone else have questions for Joel? Joel, thank you again for everything that you've done, and thank you for the update.
Thank you.
Anyone else under miscellaneous? Under announcements, we have our whole year laid out for us. In March, we'll be appointing three different individuals for Bayarnack Behavioral Health. And I should mention that in February, we will be having a replacement for Mr. Rivard for the remainder of his term. And I believe, Deanne, we did post for applications, correct?
We are advertising for the road commissioner on January 22nd, 23rd, and 24th. And I believe the deadline is February 2nd.
Then in June, we have a one-year term that's currently held by Don Carlion for the library board. In October, we have a land bank, which is a 3-year term expiring. We also have a Department of Health and Human Services Board of Directors, which is a 1-year term. Then we get into November, we have a building authority where there will be 2 6-year terms expiring. And then in December, we have Department on Aging, the Advisory Committee, and those would be four 2-year terms. That would be Districts 1, 3, 5, and 7. So just to kind of lay out what's going on for the rest of the year for 2021. Let me come to, is there any need for a closed session, ma'am?
There is not, Mr. Chair.
Very good. That being said.
Ernie, before we go, I just want to tell Deanne and Craig, I'll get a hold of, Craig got his hand up. I'll get a hold of the new appointee. I think we plan to meet next week at 3:00 for our bylaws, probably virtual, but I will get a hold of Tim Eckstein. And then our meeting is supposed to be next week, Tuesday at 3 p.m., the Veterans Affairs Committee. Craig still has his hand up.
Yeah, Craig.
Thank you, Mr. Chair. Just real quick, the Michigan Pet Fund Alliance had a delay due to coronavirus in announcing the total numbers from 2019 for shelter save rates. And as most of you are aware, we've been undertaking the task and trying to get to that no-kill status. We came really close in 2018. We finished at 89.2%, but in 2019 we achieved the no-kill status for sure, and we maintained the number of 96%. Early indications that we have for this year, we're still going through and just making sure numbers are okay to submit to the Department of Ag for 2020, and we're going to finish somewhere in that same ballpark. So I just wanted to pass that along to the commissioners and thank you guys for everything that you do to help support us here.
That's great news. Thank you, Craig. Anyone else? If not, a motion to adjourn would be, whoops, excuse me, Mr. Redmond.
As your parliamentarian, I'd like to point out Section 16, Part 2, for appointments by the board. In order to receive a consideration for appointments, such request may be submitted in writing to the Bay County Board of Commissioners prior to the date of the appointment, or may be nominated by the commissioner from the floor the date of the meeting, but the commission must have a written request from the individual stating that he or she would accept the nomination, neither of which the appointees have done.
I'll talk to Mr. Eckstein.
Yes. So we need to review and come back to our appointment for the Bay County Veterans Affairs.
I did talk to him, and he agreed verbally, but I know it was submitted by Mike Pergandy, the one from the American Legion, and but I did talk to Tim Eckstein before the meeting, and he was willing to serve, but I don't know if we need something written, and that written application.
You could go online and fill out the application and hit the submit button and confirm it, and I can forward it to the rest of the commissioners if.
Yeah.
And Commissioner Begic will also need to change our rules with regards to the Veterans Affairs Committee, because the Veterans Affairs Committee does not require that written application. It's just a nomination or submission.
Yeah. Sure. we can do that.
So are we saying that Mr. Epstein is still appointed to the,
I don't think that's a valid appointment, is it? Based on our bylaws.
correct, according to our parliamentary?
Well, it depends whose bylaws. I mean, as Amber said, our bylaws, we have administrative rules and bylaws. And it's not in there.
Committee, but as far as the board itself,
Yeah.
that's separate. So
What's the hierarchy? What's the hierarchy? The bylaws over the veterans?
No, it's our rule.
So that takes precedence.
yes,
Mr. Chair, cannot a board member move to waive the procedural rule?
You're doing so after the fact, but what you might want to do in the future is go by the rules.
all right.
If you want to,
I'm sorry?
in the future, you might want to ask the parliamentarian regarding the rules.
We're paying the big money for it.
Yes. So I'll come back to Amber. In order for this appointment to be legitimate, are you saying that we would need a commissioner then to make a motion to circumvent the
Waive the rule.
I believe that the board can at any point in time waive any of its procedural rules, but you're doing it after the fact of the appointment. I believe that you would have to move to waive the rule and then reappoint.
May I make a recommendation?
Yes.
Let's just follow the rules from on. Leave the appointment be. Because you're just going to redo it and he'll get elected again, so.
All right. So it's just
in the future, you might want to ask the parliamentarian.
very good. So at this point, I am assuming that we will have something in writing to make sure that we've got an application, and we will stand with Tim being elected to the Veterans Affairs Committee. Okay?
Yep.
Very good.
Can we,
Yes.
can we do that?
Mr. Redmond.
Well,
I mean, it's not
We did.
but it's not a legitimate appointment, so it seems to me we'd have to go through the process to do it correctly.
what you could do is just ask him to submit a letter. And then
Even though it's after
we'll
the fact.
redo it again. You can always, rescind what you did.
Okay. So we would do a reappointment in February?
Yeah.
Okay.
I'll let them know.
Very good. So we will readdress the appointment in February to the Bay County Veterans Affairs Committee.
We need a motion. I'll make that motion.
I'll
Coonan.
support.
Okay, and Commissioner Fox supported it.
Excuse me, the motion should read rescinding,
Yes,
to rescind the appointment,
yes,
to be reviewed at a later date.
in February.
Okay.
It was supported by Commissioner Fox.
Okay. Would you like a roll call vote?
Please.
We'll start with Commissioner Begic.
Yes.
Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
and Krieger.
Yes.
Appointment rescinded by 7 yeas, 0 nays.
Thank you, Madam Clerk. So that will clean that up. Mr. Redmond, thank you for the information. And with that being said, a motion to adjourn would be in order.
Coonan.
Barb, you get,
Roll call, please.
Commissioner Coonan,
Yes.
Herrick,
Yes.
Radke,
Yes.
Johnson,
Yes.
Fox,
Yes.
Dudick,
Yes.
and Krieger.
Yes.
7 yeas, 0 nays. Adjournment carries.
Thank you very much.